I want to flesh out this aspect of the body as a unit even more and look at relationships. So think about a mother and a father who have a child, and that child becomes addicted to opioids. Now, that's an abnormal situation. Generally, the opioids are from the person addicted to them, it's the solution to the problem they're dealing with, some sort of trauma. It's a compensation. And it's not a functional compensation, right? It moves them downhill. It actually worsens the situation. But they're addictive, so it's really hard to get away from them. And once you become dependent upon them, to not take them is unbearable, right? You go through withdrawal. Now, we can all see how the dysfunction in that child will create a strain on the parents. How can the parents feel at ease? How can they be in a state of contentment when their child is going through this suffering? There's a relationship, even though they're not physically connected. There's this emotional relationship. There's an energetic relationship. How much the more so in our own bodies, right? If the ankle isn't functioning properly, well, it's going to pass through an imbalance to the knee, and then that'll pass it through to the hip. And then somewhere the body is going to be compensating, so they'll have a symptom show up. Tension in the outside of the shin and the fibularis muscles, and then usually tightening in that hip joint and pain at the sacroiliac joint. The reason this approach hasn't mainstreamed more is because we have not yet been able to make it visual. We can look at landmarks and we can see changes in landmarks with treatment, but appearances can be deceiving because some asymmetries are functional and we don't expect to resolve those. Like someone can have scoliosis and bad back pain, and we can treat them and their back pain goes away, but they still have scoliosis. So we've normalized the function by helping them find that balance, but it wasn't through getting rid of all asymmetry. It's really about reestablishing the fluid wholeness of the body. Right, I referred in the first part of this video series to that single cell state at conception, where the fact that we're a fluid whole is really incontrovertible. Once we grow and develop all the way to our adult form, it can be a little bit easier to think that we have these separate compartments. But in truth, everything is integrated. And whatever a patient brings to the osteopath, we work to find balance within that system. We don't imagine that we're going to create the ideal, some imaginary ideal balance that's not unique to them. Everybody has their unique balance. I mean, they're alive. They're here in this body. It's developed over their whole life. That there is a balance that they can strike where they have minimal discomfort, where they're able to enter that deep rejuvenative neutral on a daily basis, and that can help refresh their whole system. So this is what we mean when we say holistic treatment. Osteopathy has been holistic since its inception, and before this term of holism became like a buzzword that's used, where we are just not ignoring any dynamics, and we're looking for the health within someone. We're looking to find the footprints of the health, the rhythms that the health is creating in the body, and to ally with those and to work with those. We're looking to reestablish normal structure, not an imagined ideal, but what's normal for that individual. And the osteopathic practitioner doesn't say this is normal, go there, be there. What we acknowledge is that there are maintaining forces in the body. So we have to work with those forces because that's what's going to maintain the normal. If we go back to this analogy of a child who's addicted to opioids, the parents can't just say, hey, stop it. Stop using opioids. Or they can't just take their opioids away. Because what's going to happen is that kid's probably going to leave and find them on the street. And right, you can't fix that problem that way. So frequently to solve the problem, we have to go into it. We have to balance around the pathologic neutral that was set up by the trauma. This works with physical injuries, but this is also how therapists work with mental, emotional injuries. Take, for example, someone who found out their spouse was cheating on them. and they'd been with their spouse a long time, and they were really surprised. They're really shocked by this discovery. You can't just tell them to get over it. What does a good friend do? A good friend makes himself available, sits down, creates time and space, and they're receptive to what their friend is going through. They listen. And their friend is already working through this. They're grappling with the emotions and with what it means about the world, with what it means about them. And the role of the friend is to keep them from getting stuck in these extremes of hopelessness, of despair, of like really negative self-talk, or being, just blaming and being resentful and holding on to that. But they're helping keep them balanced in their experience of that trauma, of that emotion, until eventually something helps that person move on, right? Something changes and that person's no longer stuck and they're ready to move forward. We can see when that process isn't done well, a resentment remains, a residue of the trauma remains, and that person will continue to have problems in their future relationship because of issues with trust. And so it's very important that they're able to complete what happened. And how they complete what happened is going to be individual to them. It's going to be a process that happens in a certain sense passively, right? They need to let go of trying to figure it out and change it and think about it. But they need to be able to sit with the emotions and witness them and let them be okay. Let them come to balance. Let them move through. And then on the other end, they get some sort of insight. They get some sort of understanding of the situation, some understanding of what brought them into that circumstance, what had them remain in that circumstance, understanding of the other person. And it's through that gentle understanding that someone gets freed from the pitfalls of either blaming themselves or holding resentment to the other person. And this is just like how the physical body works. If we have something stuck over this way, we can't just force it the other way and stretch out the side that wasn't stretched out to match the side that was, because now everything's too stretched out and it'll just be unstable, and so there'll still be problems. We have to go to stillness, and we have to go to this deep listening. And then through this deep listening, we let the ease guide us to that very specific neutral stillness, and then the inherent forces take over. And they actually manage the release. I hope that this helped you understand the unique gift that osteopathy has to offer, and to also appreciate how osteopathy has leaked out into these other practices. Like, why do massage therapists, chiropractors, physical therapists, why do they all want to learn from osteopaths and practice osteopathic techniques? It's because they work. And osteopathy has this rich tradition of mentorship, and that makes a big difference in someone's ability to learn, and the speed at which they learn is being able to stand on the shoulders of giants, being able to go into the office and work with someone who's been doing this whole career, and to be rapidly brought along in how it's done. So my intention in this video is to do my small part to raise awareness for osteopathy. If you're an individual dealing with some sort of problem, I encourage you to seek out a good osteopath. The Centers for Traditional Osteopathy, if you Google that, there's a physician directory. You can find providers there. Also, the Osteopathic Cranial Academy is another good organization that has a directory where you can find providers there. Now, all the great osteopaths won't necessarily be in those directories, so you can also look on Google. Be sure to check reviews. If you're a physician or you're a care provider, maybe you're doing something that you learned either directly or indirectly from osteopaths. Maybe you're a massage therapist or a physical therapy practitioner. I encourage you to create a relationship with an osteopath. So when you run into problems that you can't solve, you're getting a result that's not satisfactory for your patient, that's not satisfactory for you, that you have that ability to refer. Because that, I think, is really the normal situation, is that these techniques are being employed by in a certain degree, are being employed by all these different providers. Well, if they find that they're not able to bring something back to normal, ideally then they refer back to osteopathy and recognizing that, hey, these approaches work, and someone who has grounded themselves in these approaches their whole career and devoted themselves to the study of this art and science, well, perhaps they can move something along that I've gotten stuck with. So that's, if you're someone listening to this who's thinking about referrals, that's what I would recommend, is find an osteopath who you like, who does good work, and so that you can refer when you get stuck. Okay, thank you very much, and I hope you have a great day.